Hi everyone, it's Marc the Bruin from simplifyinglife.com.au. Today in this video I'd like to discuss a topic that I often get questions about in my practice, and that is, do you offer Medicare rebates? In Australia, when you're watching this from another country, in Australia there's a government subsidized scheme for mental health professionals, or for clients that want to see mental health professionals, and it allows these clients or patients to get 6 plus 4, so in total 10 sessions per year with a psychologist, a social worker or a psychiatrist. Now, you don't get everything subsidized, so you're generally still out of pocket unless this mental health professional bulk bills, but that doesn't often happen. But you can get some of the price that you'll pay for this mental health professional back through the Medicare rebate. So say that the psychologist is charging you $200 for a session, you get up to about $100, I think, can be off, but up to about $100 back through the Medicare rebate system. So you'll be about $100 out of pocket still. Now, is Medicare a good idea? Absolutely. Look, if you need the help and if you can find a bulk billing psychologist, then there's no cost to you, and you can still get 6 plus 4 if needed sessions every year to help with your mental health problem. So in essence, it's a good idea. There's a couple of downsides that people forget, and I want to touch on those ones today, because a lot of people go like, if you don't do Medicare rebates, why would I come and see you? Well, that's a totally different question. Why did you want to come and see me? But the general question is like, is there such a difference between counsellors, what I am, and psychologists and social workers in that field when you start relating it to the Medicare rebate scheme? Well, there actually isn't, the other than the fact that social workers and psychologists can get a Medicare rebate for you, or you can get it when you go and visit them. But there's a couple of downsides to the Medicare rebate scheme that people don't often consider, and I just want to touch on those today real quick. One of them is that you'll actually need to go and see your GP in order to get what they call a mental health treatment plan or a mental health care plan. So you can go, based on that one, you can go and see a psychologist. Now, in order to qualify for the Medicare rebates, you actually need to be diagnosed with something, whether it's generalized anxiety disorder, whether it's major depressive disorder, whether it's bipolar disorder, whatever. Adjustment disorder is another one. So you actually need a mental health diagnosis. So from that point forward, if you go for the cheap option or the cheaper option and say, look, let's do that, be aware that from that point forward, you will have a mental health diagnosis stamped on your forehead. You will have a sticker on your forehead saying generalized anxiety disorder. Now, in normal life, that probably will not hurt you too much. But for some people, that stigma is not a good thing. Second of all, it actually can have repercussions when you want to apply for jobs that require you to do a mental health assessment. And the biggest thing that a lot of people don't think about, and I think needs pointing out, is that it can actually affect you when you apply for life insurance or when you apply for income protection insurance. And that's a thing that often gets overlooked. Most insurance companies, especially for life insurance and often also for income protection insurance, will ask you a question along the lines of, have you ever been diagnosed with a mental health issue, problem, diagnosis, or something like that, with a mental health problem? And in that case, you will have to answer yes. Reversely, if you already have life insurance in place or an income protection insurance and you go see the GP for a mental health care plan, you will then technically have to inform your current insurer that you now have been diagnosed with a mental health issue, with a disorder, which most people don't do. And that could lead to problems down the track. When you take out an insurance, there's a fair chance that based on your diagnosis by the GP and the fact that you've taken out a mental health care plan, that you will pay higher premiums. If not that, then there's even a chance that you might get exclusions on mental health issues, so that this life insurance will not pay if there is an insured event, but that event is based on a mental health problem, or they deem that to be. So you got to be really careful with these things that seem so simple, just going to a GP and get a referral to a psychologist, because they can have implications for your insurance. Premium higher, potentially exclusions, potentially not mentioning to your current insurer that you've now got a mental health problem, and they might just not pay out when you need it down the track. So keep that in mind. Another one is, mentioned that already, so leave that one. If you have to go into a job where mental health assessments are part of the recruitment strategy, you will have to actually do those and have to mention that you already got a pre-existing mental health condition, because you do if you get that Medicare rebate. So, and on top of that, that's the third or fourth one, I don't know where I am at this point. You got to remember that most psychologists with a special interest area, or clinical psychologists in general, will charge you a fairly high rate anyway, and that's because they're professionals. So counsellors, psychologists, social workers with a special interest area, like for instance I do mindfulness integrated CBT and a lot of other things that require some specialist training, will generally ask more than a general counsellor or a general psychologist. So as I said before, there is a fair chance that you'll have to pay a certain amount of money anyway. Say again that this person will charge you $200 for a session, then you'll still be about $100, $120 out of pocket anyway, including your Medicare rebate. So that's already come off. Now, when you start looking at all that, the question becomes really poignant, is like, isn't it just better to leave all that GP stuff behind and the psychology stuff behind and find your own psychologist, counselor, social worker, whatever you're looking for? And I would say from my experience, and I know this is my opinion, sometimes it just is. Sometimes paying potentially $20, $30 extra, to see a private counselor, a private psychologist, a private social worker, without all the Medicare hassle, rebate, and the fact that you have to visit your GP and get that mental health care plan and all the hoo-ha that comes from that, why not just see this person, this mental health professional privately? Maybe pay a little bit more, but don't have the diagnosis on your forehead. Don't have all the hassles with life insurance, income protection insurance, and premium rises and exclusions, and potentially employment opportunities that might pass you by because you got a mental health problem. Why not skip all that? And I wouldn't even pose it as a question. I would actually say just skip all that. You don't have to necessarily come to me, even though I'd love you to come to me. But think about the fact that going through what seems so easy, going through the GP system and getting a mental health referral, could actually bite you in the backside quite hard and turn out to be more expensive than just seeking out a professional that you think is going to serve your needs best. Not because they're the cheapest, but because they serve your needs best. So have a good think about that. Medicare system, great, works well for many Australians. In mental health, same thing. But you gotta be aware about the consequences and the ramifications of doing so. And sometimes the price you pay for the prize with a Z you get is too high. You can better off skipping it. So have a good think about that. If you got questions, ask me. Obviously, this is very generic, general information. Seek it out for yourself, but be careful with this whole mental health diagnosis stuff, because you don't want to bite it where you don't like it. Have a think and let me know if you got questions. Have a good day.